All right, good morning. Welcome. We're just going to wait as more people join us, give a few minutes for folks to join us. Welcome. To be great to know where you're joining us from. Guys. We're just going to wait a few more minutes for folks to join. All right, good morning, colleagues. Good morning from a really cold and wet Cape Town. I hope it's warm wherever you're joining us from. While we wait for more people to join us, it would be great to let us know where you're joining us from in the chats. Morning. I am Elizabeth Baini, Research Specialist at Ilifa Labantwana, and your host for today's webinar. You're welcome. If you are new here, you are in fantastic audience. Today's conversation promises to be a really interesting one. As always, this is the Early Childhood Systems, Perspectives, and Research webinar series, a joint initiative of Ilifa Labantwana, Research on Socioeconomic Policy, that's RESEP at Stellenbosch University, and Data Drive 2030. Our aim is to explore the latest perspectives and research on issues affecting the early childhood development service delivery ecosystem and to create change for children through the promotion of data and research. So this is a monthly conversation that we have on issues that affect young children and their family. Welcome. For those who are joining us still, it's good to have you in the room. Today's conversation is actually one that I'm really, really excited about. As you know, the care economy encompasses the paid and unpaid labor required to provide for the physical, emotional, and developmental needs of others. So that includes children, the elderly, the sick. In South Africa, this sector remains largely invisible and informal. According to the 2010 Time Use Survey, South African women spend about 6 times more on unpaid care work than men. This leads to a significant time poverty that hinders their participation in the formal employment or the formal workforce. Attached to this problem is also a deep-seated social norm that caregiving is exclusively a female duty. This prevents the redistribution of domestic responsibilities, right? So it then leads to women shouldering most of the care work or the care responsibilities in the home. So why does it matter? Why are we looking at this specific issue? And for us, we believe that the women's economic empowerment and women's workforce involvement and getting children what they need to develop and to thrive by 5 are two sides of the same coin. And so the conversation needs to be had in tandem. We have to address the challenges that affect women and the challenges that affect children simultaneously if we want to indeed get the results that we want by 2030. So this morning we'll be looking at the topic, Carrying the System, Women's Invisible Burden in South Africa's Childcare Model. Before we begin, a couple of housekeeping for us. We encourage folks to put their questions in the Q&A box so that we'll be able to easily track them and address them after the presentation. After the presentation, also, you will get the opportunity to raise your hand and ask any questions or contribute any valid points that you have to the conversation. We do ask that you don't put questions in the chat box because it might get missed. So if you have a really burning one, either raise your hand or put it in the Q&A box. Now, allow me to introduce our presenter for today. Today, we are joined by Lerato Shai, who is an independent labor economist and career coach focused on accelerating women's labor market outcomes through a feminist lens. She is working with us, Ilifa Labantwana, on developing a national childcare agenda and is supporting our she supported the review of the South Africa's childcare system. So this is the report that most of this conversation is based on, but it's not exclusively limited to that specific report. We will share the resources in the chat box as we go along. Lerato is also supporting Harambee Youth Employment Accelerator on an ECD livelihood strategy in fulfillment of the DBE's Banapele 2030 blueprint and with research to advocate for a care economy master plan for South Africa. She was previously a director in the presidency responsible for the Presidential Youth Employment Initiative. That is all to say that we can't get any better than Lerato in helping us to understand the role that women play and how supporting women, women's workforce participation and women's rights and addressing issues that affect women indirectly or directly addresses some of the challenges we see in the ECD ecosystem as well. So it is with pleasure that I invite you, Lerato, to share with us what you have, and we will then explore the questions after your presentation. Welcome.
Thank you so much, Liz, and good morning, everybody. I'm very excited to be joining everyone and super excited to have this conversation with you all, and very excited to hear other people's thoughts on what I'll be putting forward. So, as Liz has said, a big chunk of this presentation is actually based on the report that Ilifa published last year titled Unlocking Affordable and Quality Childcare to Benefit Women, Children, and the Broader Society, which is a review of South Africa's childcare system. I am also drawing on some of the work that we're doing with DBE on a livelihood strategy within the early learning system specifically. So this is how the conversation is going to flow today. I'll start with setting the scene, where I will really be predominantly, firstly, locating the childcare system within South Africa's broader care regime. And then I'll take you through an overview of South Africa's childcare system and do a deep dive into two key components that are relevant for the conversation today. I'll conclude, and then I'll also wrap up with some of the critical actions that we are putting forward in this report for what we need to shift in the system. So the childcare system does not exist in a vacuum. It is a central part and a critical part of South Africa's broader childcare regime, which is actually currently defined by very specific structural characteristics that then also shape why the childcare system in South Africa looks the way that it does. The first is that a lot of our policy design centers the family as the core deliverer of care. in our country. So both the White Paper for Social Welfare and the 2012 White Paper on Families places the family as the central primary provider for care provision, with the state only playing a supportive role. These two particular instruments were criticized quite a lot for ignoring the gendered patterns of care provision, predominantly the fact that women are actually the main people inside the family that are actually doing the care work. There was some revisions in the latest white paper on families, but this version also still continues to only see the state's role as supportive. It also doesn't include any indicators for how we then monitor the redistribution of care within the home. The second key characteristic is that our care regime is actually a dual system that's been shaped by a legacy of apartheid, colonialism, and this legacy persists along several lines, including income, gender, and racial lines. But essentially, you have two systems that are operating in the country. You have a formal care regime that has actually retained a lot of its liberal features from apartheid days, where those with access to income are able to then purchase the care that they need in the private market. So they're buying domestic labor, childcare services, they're able to insure themselves, they're able to then put their elderly who need care in private institutions for that care to be provided. Then you have this informal care regime that continues to largely be accessed by Black African households in the country, that is then dependent on kin, and kin being primarily women inside the family. So this has sort of retained these conservative features, and it's still a legacy of how this regime was operating even during apartheid days. A third key dimension is then how we make policy and how we design our programming in the country. And early on, as we came out of apartheid into the first days of the democratic dispensation, we adopted a very neoliberal approach to our economic policy making. Chief of which I think was in the introduction of GEAR, the growth, I always forget this, growth, employment, and redistribution, I think it was called. And what that particular policy did is to really start shifting service provision away from the states towards the private market. So we saw a huge reduction in the state's role in directly providing services with the introduction of GEAR, and that has persisted and is actually part of the architecture of our economic policy making. And what that has meant is that we have significant gaps now in the provision of quality care in the country, and those gaps are either imperfectly addressed through the market, but actually largely are resolved through a deep reliance on unpaid and underpaid or undervalued care labor that is performed by women. So in effect, you have a care regime that in theory and a little bit in practice is really bringing together the four key actors in what is called the care diamond. So the state, family, households, market, and not-for-profit coming together to hold different responsibilities in the provision of care in the country. But in fact, in practice, at its core, it really is actually sustained by women's unpaid and underpaid care labor. And that is a very important structural feature of how care is actually provided in the country overall. A fourth dimension or fourth structural characteristic of our care regime is that it is in fact very blind to gender dynamics. And in that blindness, it serves to then reinforce the prevailing gender patterns of care in the country. So it's largely under-acknowledged in our policy and programming. And this reliance on women is then made possible by a deeply patriarchal system that privileges men over women, purports very harmful norms and attitudes that violate women's rights, but have also then led to this gendered imbalance in the provision of care. The last piece of the structure that I wanted to share that we articulate in the report is also this long legacy in the country of family disruption that has then shaped the way family structures look There have been very dramatic changes since democracy started. Extended family living, African children who are largely not residing with their biological fathers. I think it's over 80% of African children specifically. And the migrant labor system had a big role in shaping these family structures. And what it's done, so I think sometimes a lot of the literature tends to allocate cause to the migrant labor system. But in fact, what has really happened is that we have a very patrilineal system. So children sort of belong to their fathers. So extended living was actually normalized in the country. So what the migrant labor system actually did was scale that up and sort of entrench it as the dominant family structure in the country. What the data also shows, or the literature rather, is that where we have female primary caregivers who are in mother only or neither parent households, what you're actually finding is that in those contexts, assistance is primarily actually provided by other women. So this absence of men in caregiving is also very much a key structure in the way families are being organized. Lastly, the HIV/AIDS epidemic, as well as the very high levels of unemployment in the country, have really shifted the role of older people in our family networks, where concentration around that older person, especially where they're receiving the old age pension, means that they've taken on a very key role in the provision of care themselves. So ultimately, what you see is a system or a care regime where we continue to reproduce the inequality that we are actually trying to resolve as a country, and it remains the central architecture in our care regime. So this is the kind of context within which our childcare system then sits. And so what you see in the childcare system is actually just a manifestation of the structural elements in our care regime. So before we get into what the South Africa's childcare system is or what it contains, it's important to start with defining what a childcare system is. And we define it as a set or a network of services, policies, and regulations, as well as resources and infrastructure that the state, not-for-profit sector, markets, families, and households come together collectively to provide to support the care of children from birth to age 6, so that we can enable families, and really within those families, women, to balance their caregiving and other responsibilities. So this care diamond that was posited by Razavi in 2007 is a key analytical frame for this report. And what was really important for us in highlighting is what Razavi really makes emphasizes rather as the role of the state within this care diamond. The way it's sort of structured creates the illusion that everyone's sort of holding equal responsibility. But in fact, she really does make a point to note that the state has a very distinct and important role to play, because it is actually a very important decision maker in that what the state takes on as its responsibility to provide and to service and to resource really does influence what everyone else in this care diamond ends up doing. So it's often the case that the other three are responding to whatever gaps the state has left in the system. So what are the components, or what makes up South Africa's childcare system? This report takes a particular focus on looking at the state and the role of the state in the system. But we divide it into programs and provisioning, the resourcing, public and private funding, policies and legislation. And then what we've added, which is not typical in the way these systems are defined when we look at the literature globally, is the prevailing gender norms and attitude, because in fact they are really the bedrock of why the system looks the way it does. What these crosses here mean is simply that this particular stakeholder in the care diamond is doing something. So it's not a commentary on how much, are they doing enough, what quality, at what level, but it's just that when it comes to childcare provision, every one of the Care Diamond stakeholders are doing something. What I do want to just highlight is what doesn't exist in South Africa's childcare system at the moment, which are three key things. The first is subsidies to parents for childcare, which either take the form of a voucher in other countries or particular conditional cash transfer to those households to then pay for childcare outside the home. We also don't have any incentives for employers. There are some countries in Latin America that have even made this law that if you're an employer, you have to provide childcare in your place of work or make sure your employees have access to childcare. We do not have that. And lastly, we don't support childcare anywhere in the tax regime. So there are countries who will have tax benefits that allow people to be able to have access to childcare. The last thing I wanted to point to here is also that in the way South Africa interacts with the system, it's a very particular nuance or a particular emphasis or focus. We have a very strong emphasis on early childhood development, which covers the parts in red here. And that's where a lot of our efforts are going in terms of when we think of childcare. But in fact, the childcare system is obviously a lot broader than that. And all these other elements do exist, but we do not operationalize childcare in this entirety. When we think of childcare, we're really actually speaking of ECD, or that's what comes to mind. And I think this is just important to hold as we proceed. So I said I would deep dive into two components, starting with childcare, which is really where currently a lot of effort is going in, the provision, so the service provision aspect of it, which manifests in the country, specifically in the ECD programs, and within that, early learning getting a lot of attention at the moment from the DBE through the Banapele movement that is being currently in play and is being implemented as we speak. But this is just a snapshot of what is childcare provision in the country, starting with the programming. This data comes from a combination of the ECD census, the recent Thrive by 5, as well as the Banapele blueprint itself. But we have just over 42,000 programs. Most of them are small. Many are self-starting providers and receiving very weak formal support, very weak monitoring at the moment, and uneven quality. The workforce is about 198,000 plus strong, operating independently, predominantly very low and unstable incomes, which limits the ability of those who start these programs to actually hire staff, invest, expand their programs so they can reach all those children that are currently excluded. And then on the funding side, the dynamic is in fact of a privately provided service with very partial government subsidization. So 69% of the programs primarily rely on fees from households. The subsidy is currently at 24 Rand per child per day, as many of you know, far below the actual cost of provision, which really matters for those households that are in quintile 1 or 2 on the income spectrum, who actually cannot afford to pay fees at all. And only 27% of about 2.3 million children that are eligible to get the subsidy are actually currently getting it. 1 million plus, I think it's about 1.2 million of children aged 3 to 5 do not have any access at all to any of these programs. And of those that are not enrolled, 77% of households that reported this in Thrive by 5 say that they can't put their children in any program because they cannot pay the fees. And then on learning outcomes, what is coming through in the recent data is that 42% of children aged 50 to 59 months are, only 42% are developmentally on track. 82% are not on track in at least one domain. There's several domains that the Thrive by 5 looks at, and quality varies widely across context. And it is actually also linked to how high the fees that are charged by a program are. So there is a relationship between those two as well. And then the regulatory context, registration remains a very important gateway to funding, but it's extremely complex. There are a lot of barriers to accessing it, and it is currently excluding many of these providers. Policy and funding are also misaligned with early learning more and more, especially with the function shift from the Department of Social Development to the Department of Basic Education, being treated as education and policy. But in fact, the funding model is still a welfare one. So it's a partial or residual welfare subsidy, as opposed to the same logic that's used to fund schooling. So, in summary, we have supply that exists but is fragmented and poorly supported, a very strong workforce, but that is very severely economically constrained. We have a system that is primarily privately funded with partial subsidization from the states. The demand is suppressed by affordability. We have unequal access and quality that produce unequal learning outcomes, and very strong policy intent, but funding levels and design that is actually misaligned with that intent. So what is then the implication of a system that looks like that? And the implication is really that you have women acting as the shock absorbers of these gaps. They absorb the unpaid care work. So the Time Use Survey of 2010 shows that women perform 6 times more unpaid care of persons than men. So it measures all forms of care, but in the care of persons, including children, women do 6 times more that work. Women sustain the labor force in the childcare system. 90% of the ECD workforce is female, and the majority of them earn well below the national minimum wage. So there's a subsidization of the system by these women. They also shoulder the administrative burden in terms of the delivery of the services that the state does have in place. They're the primary users of the child maintenance system because of their role as primary caregivers. And they're also the primary recipients and administrators of the child support grant. They then, because of all this burden and all this labor that they perform, they bear the economic penalties thereof. So the quarterly labor force survey asks a question every quarter of the people who are not participating. What are your reasons for not participating in the labor force? And of the 2 million that responded, 88% of them that said that they don't participate because of family considerations or childcare were women. And then we have a labor force participation gap in the country with women participating far less than men currently. So that's the effect. And what then this sort of in analyzing this, what really emerges from an analysis of these dynamics is that, in fact, our childcare system, especially this early ECD, early learning component of it, has a very fundamental structural condition where, in fact, when you look at the regulations and the regulatory system, we're regulating it as if it's education. So we regulate these providers similar to what you'd regulate a school. So we treat them in that way, or a school, or even a business, a market provider. You want them to be zoned as businesses, etc. But in fact, we are funding it as welfare. So there's a strong misalignment there. Because in fact, when you look at childcare, it really performs 3 functions simultaneously. The first one is care and supervision. So children need to be safely looked after while adults work, search for work, manage household survival, etc. And a lot of the households in this country that take their children to an ECD program or early learning program are really trying to resolve this particular function. It's really about who's going to look after my child, and will I feel safe? Will I feel comfortable knowing my child is safe where I have put them? The second key function is the labor market enablement piece. So childcare is an economic enabler, especially for women, reduces time constraints, allows them to participate in the economy, allows them to access work in the sector, in care sectors, but also elsewhere in the wider economy, and seek education or other income generating activities. And then the third function is this early learning and development piece of it, which is then these organized programs outside the home that allow children to then be supported with cognitive development, physical development, etc. But then there is this misalignment because when you look at policy discourse currently and the regulatory system, it really is emphasizing this piece. The current funding model, which is really a child welfare model, is really speaking to this piece. This piece, the labor market piece, is actually extremely underaddressed. This is starting to shift, but it's been historically extremely underaddressed in the way we think about childcare in the country and the way the system is has been designing its programs and policy responses. And this is despite the fact that there is actually a strong public interest rationale for the state funding early learning for labor market enablement as a key interest in addition to the others. So what is really a contradiction is that you're really trying to produce these education outcomes with a welfare-like funding model and a private household-driven cost recovery model, because the private households are the primary funders of the childcare system currently in South Africa. So this is a problem. Why? Because in fact, childcare is a public good. It has public good characteristics. It produces benefit that go well beyond children, well beyond women. It really is society-wide benefits that mean that it becomes a problem if you're trying to achieve universal access, equitable access, but you're trying to do that with a market mechanism, because the market is always going to create access or services where there's ability to pay and not where there is need, which is what universal access and equity is really geared towards doing. So in fact, if we want to resolve and achieve our goal in the NDP to get to universal access to quality early learning or quality ECD, and for us in terms of broadening it to quality childcare in terms of the system in its entirety, we are going to have to rethink our reliance currently on these market mechanisms to deliver a service that has these strong public good characteristics. What would change if we did that? What would change for women if these childcare systems worked? Specifically, and I guess my labor economist bias is going to come through here, but in terms of these economic penalties that they're paying. And in fact, South Africa doesn't have any local studies where we've looked at the effect of childcare on women or the effect of early learning programs on women specifically. So we've drawn in the paper on evidence from the global south, and Latin America is probably the furthest ahead of many of us in terms of how far they've gone with shifting their laws and introducing care policies that embed care as central social and economic infrastructure. But these are just some of the papers that we include in the report. A paper in Argentina that looked at the effect of childcare on mothers specifically found that on average, 13 mothers started to work for every 100 youngest children that attended preschool. And they make a big point of saying that it has to be that the childcare is provided all the way to the youngest child. Otherwise, the parents still can't, or the mom still can't go start work. Uruguay did a study where they looked at what the effect of childcare is on women's labor force participation, and they actually looked at the comparison between whether that childcare arrangement is formal or informal, and found that if your objective is actually to raise women's participation in the labor market, it really does matter that you assess what informal arrangements are being accessed already. Because if your public programming is merely going to substitute informal arrangements that were actually already in play, you may not see any effect on women's labor force participation. But what matters here, which the Brazil study was able to do that we looked at, is a lot of the studies that look at this relationship are actually very much focused on the mother And in fact, what we know in context, especially in the global south and in our context as South Africa, is that a lot of that informal arrangement is the childcare being performed by grandparents or adolescent siblings, other women in the household or in the family. And this study in Brazil actually looked at that. So they designed the study to be able to look at not just the labor force participation of the mother, but also those of other women in the household. And they found that, in fact, you do then see a bigger rise in the participation of grandparents and adolescent siblings, as the parents typically were already working and relying on their labor to be able to access the labor force. In a review of studies in Latin America and the Caribbean, Diaz and Rodriguez Shamuzi looked at what the effects are from different quasi-experimental and experimental studies that have been done in that region of the world, and found that there's significant effects to maternal labor supply, and that supply is actually consistent regardless of the type of arrangement, whether it's formal or informal. And then the World Bank did a RCT in Burkina Faso where they introduced a public employment program and attached a childcare element to that. So they had programs that were started to enable women to participate in those public employment programs, but also hired women as workers to deliver the childcare. And they found positive impacts on both, but actually a much greater impact on the women who were then able to secure those jobs, an employment impact, on the women who were able to secure those jobs as childcare providers. Lastly, this last paper actually was great in that it really looked at a review of all these studies to try and ascertain, when you are trying to design as the state an intervention around childcare, what conditions do you need to include in your designing that would actually allow you to also achieve your gender targets or gender outcomes as a country. And what they found is that where you see these positive effects, it's where, when the design was made off the bat, the design included the mother or women in mind. So this is particularly relevant for opening hours, matching those to typical hours of work in your labor market. So have you designed upfront with the women labor market outcomes, or even women's outcomes more generally in mind, or were you just focused on children's outcomes only? The child's age was another one they looked at, and found that women were more willing to place older children, and maternal outcomes were actually found to be strongest for children aged 3 to 8. And this also is, again, part of the norms, and it's very prevalent across the global south, where that 0 to 2-year-old age, there's still very strong norms for that type of care happening inside the home, and children staying particularly with their mothers between that 0 to 2 years old. So take up of childcare programs, even where they're available, take up is very low for that age cohort. The last was on targeting low-income households, whether to target them specifically in the design, and their mixed results that were found on this one in terms of concentrating the efforts towards low-income households. And one of the reasons put forward is that often childcare is not the only lever you would need to have in place. So you may provide childcare, but if the economic context or in that geography or within where those households are is such that the opportunities are very low, if you don't then have complementary support, such as active labor market programs or training or whatever other barriers to accessing the labor market that are there, they're not then stacked together to produce the outcomes, then childcare alone may not provide any results. Okay, the second component I wanted to take everyone through was just this central one, which is the bedrock of what shapes the care regime and the childcare system as well, is the gender norms and attitudes, and the extent to which the system is actually deeply patriarchal. So there's a few studies that actually do exist in South Africa that give us a sense of what the state of the gender norms and attitudes in the country are. The first one is this study on gender-based violence that was released by the HSRC with the Department of Women, Youth and Persons with Disability in 2024. And they found that the majority of South Africans, both women and men, actually still hold the view that a woman's most important role is to take care of her home and cook for her family. And they looked at ever partnered. So if you had ever been in a partnership, heterosexual, actually, let me not tell lies. I can't remember if it was heteronormative or not. The second one was that 69.5% of men believe that a woman should obey her husband. So evidence here of a remaining patriarchal leaning in our system. And yeah. The second is also from the HSRC on leave, slightly older, and is probably now superseded by recent court judgments on leave as well. But in 2012 and 2022, the HSRC did do the study where they looked at what South Africans' view is on who should take leave. Whether the mother should take the entire paid leave period and the father take none, whether the mother should take most, etc. And what we see here is that there is a shift away from a belief that the mother should just be solely responsible for taking the entire leave that's available, but still a predominant view when you look at the first two that it still does lie the main responsibility with the mom for taking that leave. Many of you will know that last year, the Concord did confirm a shift in the leave regime of South Africa and towards shared parental leave. It's very new, the revisions still have to be made and enacted, but yeah, it's a step in the right direction in that regard. The last piece on this is both from the State of Fathers report and another piece of work that really looked at the norms that really affect men, because patriarchy harms everyone, men and women. But there's still a very strong norm in South Africa for men to play a primary breadwinner role, despite our very high levels of unemployment. So the economic context has in fact shifted dramatically, but these norms remain intact, such that it's very difficult to then comply or live up to those norms. And the State of Fathers report finds that, in fact, the inability to do so does result in men who can't play these roles sort of disengaging from their families because of shame and the humiliation of not being able to do that. What's the state of our efforts to shift these norms? I'm sadly the bearer of bad news here, because this is our own self-assessment as South Africa of our performance to critical gender and women's empowerment issues as part of the Beijing Platform of Action of 1995, which South Africa is a signatory to and is working towards achieving the key issues that this particular global instrument is pushing forward. And I just want to highlight where we are saying we have done very little. We're very good at the policy, legislation, formulating, etc. And we've done some work around different areas, education, social protection. We've actually done very well, at least on primary education, in terms of getting to gender parity. But where we really are failing is in women and girls' rights to be free of violence, addressing patriarchy, sex stereotyping, and gendered roles and divisions of labor, and addressing women's unequal share of unpaid care work and households' responsibility in our GDP. So we've marked ourselves here as no progress. And this report in particular speaks to the lack of very explicit interventions from the state in dealing with these issues beyond just public campaigns and education, etc., but really tangible norm shifting interventions in communities that are working to shift these three areas in particular. And yes, there are recent shifts, especially around the violence piece, with GBV being declared a national disaster, but again, still very much early days. So a critical gap, and again, I am focusing here on the role of the state, because in fact, what we know when it comes to norm shifting is that civil society in this country is doing all the heavy lifting. A lot of the work that is happening is actually happening through civil society. But in terms of a public state response to this, very little has been done. And where I think there is a gap, even with civil society's efforts, is that there's a focus on the redistribution of care within the home and changing of norms within the home. But I think in terms of the care diamond and really shifting responsibilities away more towards the state, and the state taking on some primary responsibility, if we all acknowledge care as a public good, it needs to still be happening. There's not enough of that happening in the country. But in closing, the review shows that South Africa's childcare system currently relies on women's unpaid and underpaid labor to compensate for gaps in public provision, funding, and support. We've made a lot of progress and continue to, and actually the ECD early learning space is in a very exciting moment currently. There's lots of momentum. We are ripe for very critical structural and catalytic change. But we have actually driven this agenda without locating it in this broader childcare system and treating childcare as essential and socio-economic infrastructure. We have actually centered on realizing children's rights, and our efforts to date largely did consider women's outcomes as secondary in terms of the childcare system. And that's despite our commitment to gender equality and women's economic participation that is everywhere in the Constitution, in all our policies, etc. But ultimately, if we want to unlock the full benefits of childcare, we are going to have to shift towards integrating both children's rights and women's rights within a much more holistic view of the childcare system, and recognize childcare as a public good that's necessary for socioeconomic well-being. Some key critical actions that need to happen to shift the system. The first is around this public good nature of childcare, recognizing it as such, and the state then taking much more primary responsibility in its delivery and adopting a systems approach. So taking the system in its entirety when we do our policy planning and programming, and understanding that what you do in social assistance is reliant on what your parental leave or caregiving leave policies are, is reliant on how effective your child maintenance system is, etc. So really adopting that as an approach to policy planning and programming, as well as to the way we fund the system. So we do need to increase and probably reallocate our funding so that there's sustainability and equity across all these system components. We don't go into detail in the report on specific recommendations in terms of service provision and child maintenance, purely because many recommendations are at play. And the Vanapele blueprint, in many ways, is also a response and an implementation framework to take up many of the recommendations that the sector has been making for years. So it's really just, let's actually just implement and act on all of those. Then we do need to close some of these critical national data and evidence gaps that we have, specifically around the causal effect of childcare in our context. Because in as much as there's similarity between us and the rest of the global south, there's nuances around family structure, which in fact we are an outlier, we're even an outlier on the continent. So extended family living and children living not with their biological parents is probably something that's common or happens elsewhere on the continent. But actually, when you look at the research, South Africa is actually an outlier. And then we are the highest with some of the highest unemployment. We are the most unequal. So all these nuances in our characteristics mean that there is probably nuances in the effect and how the causal effect actually occurs in our context that are worth actually investigating. And then lastly is for a whole of society national campaign, but also the design of specific interventions that are going to shift these societal norms around care so we can unlock the full benefits of childcare in our system. Thank you. I will stop there. Liz, I don't know if I was compliant with your
Um,
time, but I hope I didn't take too
Not
much
to
time.
worry, you can always come back for a conversation. Thank you so much, Lerato. You've given us a lot to think about, and the one that probably will keep me awake tonight is the trying to address the gender norms, patriarchal sort of aspect of it, because we know that psychology really
Mhm.
takes time and effort and is the most difficult aspect of any systems change work, right? You're
Mhm.
dealing with human beings and a really complex machinery up here. So I wonder if we'll be ready in time for 2030. All road leads to 2030, but I wonder what practical easy wins or low hanging fruits we could potentially target to really hit that nail, purely because you emphasize that it is also it's a foundational thing, right? It is that which underpins all of this skyscraping we are trying to do. And so I'm wondering what the low hanging fruits they are, quick and dirty, so that we at least move some of the reds and yellows to greens and, you know, ahead of 2030. But there are also other questions for you in the group. So let's address some of these.
Sure.
Um, Tracy Chambers had a really interesting point in that the direct link to labor force absorption, if there
Mhm.
is, childcare needs to be tested in South Africa. I mean, I think everywhere, but especially in our context, given the macroeconomic conditions, right? So, with
Mhm.
historically low education levels of mothers, especially in rural areas, are they able to access employment? Are they
Mhm.
employable, or
Mhm.
is there even employment opportunities to begin with? And
Mhm.
in your response, maybe it will be important to also address when we mean labor force participation or labor force and involvement, we are not limiting it to the white collar jobs or like the
Mhm.
office, like maybe
Mhm.
also
Mhm.
address the potential of the informal economy to be a real game changer in what we are trying to do here.
Do you want me to take
Yes,
them one?
please.
Okay, sure. Thanks, Tracy. Agreed, 100%. We do need to close that gap in our context. And I do think your point is precisely this paper that was speaking to low income households, etc. Like, is the effect actually just objectively positive all the time? Because you do need to stack. And this is where you sort of need to then leave just the childcare system and go into other systems, sort of hold government's entire set of mandates together, because you're actually having to stack what the Department of Employment and Labor is doing, what this particular area in the childcare system is doing, with what a DSBD is doing around enterprise support. To your point, Liz, about seeing the labor market both as employed by others and self employed, because often, even just the first rung, which is just accessing education and training, is prevented if you're actually in the home and unable to leave the home. And then I guess, yeah, the layer of the Department of Digital Communications and rolling out access to technology, which would actually be a bridge for some of that if you had access to internet in the home and you're able to access some of that in the home. So it is a stacking of different things. And so it's then beyond the coordination of those within the childcare system, but the coordination and the orchestration between the childcare system and other systems that would then unlock the outcomes we'd be looking for. So, and in your triaging, when you assess those you want to support, it's then not just assessing with this narrow view of just do they have childcare or do they not, but what are all the national outcomes? Where are we trying to go in terms of what well-being looks like, what inclusive economic growth looks like in this country, and then assessing for all of that so that you stack the right interventions of support for different contexts. That's probably how I put it.
Mm. I think a very important point in this question here is also not necessarily if there's childcare, it will directly lead to more
Yes,
women in the workforce.
yes,
It's about
exactly.
creating the opportunities for people to have real choice and not
Mhm.
so they can decide if I want to actively engage in the workforce or take some time out to actually do parenting and spend time with my family and whatever. So we are talking about real choice here, not necessarily give childcare and then everybody must move from the house and go to home because we've learned that the 0 to 2 year olds, the home environment is also an important milieu for them to develop and stimulate and get them ready for that structured learning spaces. So I think what we need to highlight here is the real choice in that
Exactly.
aspect and not necessarily the false fake, like, yeah, there is options, but really there isn't. Another
Agreed.
interesting question here is that can you share some examples of gender transformative approaches that have shifted more equitable caregiving? So either here or in the global south. I know if we look at the Nordic place, that one, yeah, it's unreal, right? So
No,
looking
no,
at
well, it's
our
not unreal
context
because they're
as
doing it.
similar.
Yeah, 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 yeah. Yeah, and I think maybe 'cause I didn't go into detail in terms of what we've done because I think South Africa's had because there are different layers to norm shifting, right? Like there's the legal and policy making because there are a lot of people with just the example of the new shared parental leave. Everyone's like, but what's the point? These men are not gonna take it up. But that is not you and yes, many of that is true, but it's then speaking to what are all these layers of shifting norms in the society. And the legal system policies have hold them to what their mandate is. They cannot be a barrier because the whole reason that this parental leave court judgment came to be is because there was a man in this country who wanted to be the primary caregiver and the law prevented him from doing so. So the law can't be a barrier to people being able to take up more equitable forms of division in the home. So we have had a lot of successes in many different aspects, not just parental leave, but also if you look at the shifts in division of assets after marriage, like marital law shifts, the Marriage Act has also just been. So there's been the judiciary is doing overtime. They are working a lot in terms of trying to shift those different areas. Then you have at the programmatic level, or maybe even at the programming level, at the level of the state, I think an underutilized instrument in our system is the education system. Starting with early learning, by the way, even this childcare system space is really an important space for shifting norms. Yes, you must intervene in the home, but the leveraging of the education system, this poor life orientation subject that many have had plenty of legitimate criticism against, but it is an underutilization. Every child, the DBE actually said recently at one of their sector lekgotla that 70% of all children in South Africa will go through a school. We don't know whether they'll
Mm,
make it to a post school, but they will all be inside a school. So what are we doing with that asset in terms of leveraging it to support gender
mm,
and gender transformative policy? So there is that, but I think it's also just Where you see changes where the state itself has taken on that as a mandate. It's itself dismantling its own normative thinking in its own. So mainstreaming is actually real in those contexts where the
Yeah.
state has taken that.
I'm going to push the limit and ask you one final question in
No problem.
conclusion. And we're going to keep it short and sweet, but we can talk for hours. So, why do we need a public provision system, which means government must directly provide the service and employ the practitioners? This can result in slower and more expensive delivery. I don't think that is what we are suggesting here, but just to clarify, what about retaining the private provisioning model that we have now? I'm talking about the ECD early
Yeah.
learning,
Mhm.
and that is government funded with government oversight and regulation. So we just need to do a quick clarification that that's not what you are advocating for in terms of a shift in the current model.
No, I'm not advocating for a shift. I'm not advocating for government starting to build schools and employ early learning. Where that is happening and there's space to do that viably, it should. But the key argument I am calling for is for a shift in the funding model, in that the state takes on primary funding responsibility. So for quintile 1 and 2, especially, so targeted children in the system and targeted families rather in the system that get supported, you cover the full cost of provision such that you eliminate fees completely for those, but you keep this mixed delivery system and you figure out how to make it to support the providers to be more viable and to support affordability where affordability is constrained, but where it actually doesn't exist, that the state takes on primary responsibility for fully covering the cost. In the same way we do for schooling, right? We have no fee schools precisely because we see education as a public good. And
Yeah.
early learning, at least, is part of the education system. So there shouldn't be disparity in the way we treat those two things.
I hear
Cool.
you, Lerato. So the take home for me is that childcare is an all of society concern, not because I didn't involve the state in my fertility plans. Therefore, they cannot be involved at the stage where I need the room to breathe to be able to look for work and to actively, look for work to get the resources to be able to make sure that my child thrives by 5 and beyond. So thank you for your time.
Thank you for having me.
Colleagues, we will you should join us again. I'm dropping the hint now. We will call on you for deeper conversation, especially around the funding and affordability conversation. Colleagues, thank you for joining us. As always, it's been an interesting one. We would like to invite you back on the 3rd of June, where we would look at cognitive gains from early learning program enrollment in 3 South African provinces using the latest Thrive by 5 data. Join us, and all the resources, the recording of today's presentation and the previous one you'll find on our social media, our website, and we will share it via email as well. Have a good day further.
Thank you.